Time for another update. Just wanted to let you guys know, I wanted to update you guys a little bit more often than I have been, but due to my hectic schedule and the things that have been going on in my life, I haven't been able to do so. So I wanted to apologize for that. The last time I updated you was about 30 days ago, so about a month ago. And so this makes it a 75-day update, or 2.5 months in other words, and from my unilateral gynecomastia surgery. Again, I had gynecomastia surgery about 75 days ago, and the doctor had to not only just remove the gynecomastia, which I had the bud form. It actually had a bud in there. It wasn't just like excess fat. He actually had to remove a mass out of my chest. And if you want to go back to the other videos to see that, you're welcome to do so. And it wasn't your traditional just removing the gynecomastia, because mine had been there for quite a long time, and the mass was actually pretty large in size, and it deformed my nipple a little bit and caused a little bit too much skin. So the reason I want to update you guys is to let you know how that's healing, in case you're going through exactly what I was going through or something similar. So he couldn't just trim around the nipple and then pluck that thing out of there. He actually had to reduce the size of my nipple, and he had to go out quite a ways to go catch the tail end of the mass that was in there. So he had to do a little bit of reshaping. So it's a little bit different than your typical gynecomastia surgery. So that's why I wanted to kind of keep you guys updated with that, especially those gentlemen who are interested in this subject, who have this condition and want to get it taken care of. Again, I'm going to stress to you, if you do have gynecomastia, get it taken care of early, and definitely do it. So, you know, because it makes you feel a whole lot better. Guys, it's been, 10, 15, probably 15 or more years since I've been able to take my shirt off comfortably around people. You know, there's very few people that I would take my shirt off around. In the past 2 months, I've gone to swimming parties and pool parties, the lake, the river, and different scenarios to where I've had to take my shirt off. And even though I have the scarring and my nipple's a little bit larger than the other side, I feel 100 times better about myself and my self-confidence being able to do so. So if you're thinking about whether or not you should do it, or not sure, you know, don't have the money to do it, get a second job, get a third job. Do whatever it takes to save that money to get this surgery done, because I'm telling you, it'll make you feel like $1 million when you get it done. So just want to encourage you guys, you know, just whatever it takes. If that means you're not going out to eat 1 or 2 extra times a week, or you know, you gotta work an extra job, or you've got to pinch pennies around the house, whatever it takes, get it done, because you're gonna feel a whole lot better being able to take your shirt off around people. Just recently I had some people over at my house, and we did some water events at my house, and took my shirt off there. And we went to a swimming party with some friends, a swimming pool party, and that was a lot of fun. You know, being able to take my shirt off and jump in the jacuzzi, jump in the swimming pool, and all that kind of stuff really meant a lot to me to be able to do that, and has boosted my self-confidence. So definitely get it done. So I'm going to take off my shirt now. I'm going to let you guys see what it looks like and what the healing process has been like for the past 75 days. I updated you about 30 days ago, so today's day 75. Show you what it's going through, and I think in about 2 or 3 weeks, I'm going to go back into the doctor. He's going to trim that thing up a little bit more and make it look even better than it is now. I'm going to have to go through another healing process, which kind of sucks, but it's definitely going to be worth it. The other thing that I kind of want to touch on briefly is the scarring. I have more scarring than your typical gynecomastia surgery, because again, he had to go in pretty deep there and reshape the nipple. So I have a hairy chest, and that's not concerning me too much, but my scars are pretty rosy in color, so they're kind of noticeable, and it kind of plays with you a little bit in your head. But what I want to do is possibly shave my chest for a couple of months. I think it's 2 or 3 months. This product that I found is called Scar Away, and it's basically like a liquid bandage or something along those lines, and you put it over the scar, and you do it every single day and keep it there as long as you can for I think 2 or 3 months, and it really reduces the appearance of that scar. I started using that product right after the surgery, and it seems right after the surgery that things were healing very fast, and everything looked so great. I mean, really good. So, but I haven't been able to use it properly because I do have hair on my chest and around my nipple, so the patch wouldn't stay on very well. So I'm probably going to have to shave my chest for a while, which is going to be annoying, and probably keep my shirt on. And but I think it's going to be worth it. So after he does the second part of my surgery and trim things up a little bit, I'm going to keep things shaved, and I'm going to go ahead and continue wearing that patch for 3 to 6 months and really get that scar to heal so it's not as noticeable and make me feel better about it. So hang on 1 second and I will show you what it looks like. Okay guys, here it is, 75 days post gynecomastia surgery. So again, they had to trim pretty far over here and pretty far over here to catch that tail end of the mass, which was actually hanging way back over in this direction here. So the tail wrapped way down this way, and again the nipple was disfigured quite a bit, so he had to trim a whole lot off the top and he had to trim quite a bit off the side. So when he comes back in, he's going to trim a little more off each side and just a little bit more off the bottom, which is going to make it more symmetrical to this side. So it's going to look a little bit more even. So there's that side and there's this side here where they worked on. Again, I have a hairy chest, so when I go ahead and put on the scar away patch, I'm going to have to shave this entire area so that way the patch fits on there and I can get these scars to heal up a lot better. So once again, this is a 75-day post gynecomastia surgery update. If you guys have any questions, just let me know. The last thing I want to talk about is the scarring is actually still pretty dense. When you go to touch it, it's still pretty dense. Right where they cut there, it kind of feels like kind of like cartilage almost, right where they did it. And on the top here, it still feels pretty tough to the touch, and when you try and grab it, it's not near as tender as it used to be, and the swelling has gone down quite a bit. And when I saw him about 2 weeks ago, he put a needle in there and he injected some kind of chemical. I'm not sure what it was, but it was to soften the scar tissue so it doesn't become too hard. And he did that across the top of the nipple. He wasn't so much concerned with the sides. But I think the next time I go and see him, I'm going to see if he can do a little bit more on the ones on the sides, because they're still pretty tough, and across the top. But he said the scarring for the swelling to go down and for them to soften enough is going to take about 6 months to a year. So it's going to take a long time for proper recovery. So just to kind of give you an idea of what we're looking at there. So again, guys, in about 2 or 3 weeks, I'm going to go in and see the doctor. He's going to go ahead and set up an in-house situation where he's going to trim off the bottom half of the nipple to reduce the size and also the edges a little bit. He's probably going to try and talk me out of trimming off on the edges since there's already scar tissue there. But I have talked to him about it, and I would feel more comfortable if he trimmed a little bit more off the sides and off the bottom. So I think he's going to do that for me, but again, he's worried about the scarring. So I'm not too much worried about the scarring. I can work with that over the next few years. So really get it taken care of if it's something that's bothering you, and I'll keep you up to date the best that I can, and especially seeing as how I'm going in for a second round and get this thing attacked. So if you have any more questions or any kind of issues or anything, just let me know down in the comments, or you can hit me up on any of the social media and I will get back to you in that form. So anyways, guys, I'll talk to you soon and update you in the near future.